Here is a comprehensive guide to magnesium sulfate. 1. Generic name, drug class, drug forms, brand name. Generic name, magnesium sulfate. Drug class, electrolyte supplement, anticonvulsant, laxative, tocolytic, antiarrhythmic. Drug forms, injection, IVIM, oral powder solution, topical, Epsom salt for soaking. Brand names, Epsom salt, MgSO4 injection by various manufacturers. 2. Definition. Magnesium sulfate is an inorganic salt used in the prevention and control of seizures in eclampsia and preeclampsia, treatment of hypomagnesemia, as a laxative for constipation, and as a tocolytic agent to delay preterm labor. 3. Mechanism of action. Magnesium sulfate works by CNS depression. It decreases neuromuscular transmission by antagonizing calcium ions at the neuromuscular junction. Smooth muscle relaxation. It inhibits uterine contractions and dilates blood vessels. Anticonvulsant effects. Stabilizes excitable membranes. Laxative effect. Oral, osmotic action that draws water into the intestines. 4. Indications. Prevention and treatment of seizures in preeclampsia, eclampsia. Hypomagnesemia, magnesium deficiency. Constipation, oral form as a laxative. Tocolysis, preventing premature labor. Arrhythmias, e.g. Torsades de Pointes, barium poisoning. 5. Contraindications. Heart block, myocardial damage, severe renal impairment, risk of magnesium toxicity, hypocalcemia, acute dehydration, bowel obstruction for oral forms. 6. Before taking this medicine, precautions. Inform your doctor if you have kidney disease, heart disease, low calcium, or gastrointestinal disorders. Use caution in the elderly or pregnant lactating women. Monitor closely. Regular monitoring of magnesium levels, reflexes, respiratory rate, and urinary output is essential. Avoid other magnesium-containing supplements unless prescribed. 7. How to use. IVIM, hospital use, administered by healthcare professionals. Dose and rate depend on condition treated. Oral form, laxative, dissolve in water and take as directed. Topical Epsom salt, dissolve in warm water for soaking. 8. Dosing information varies by indication. Typical adult dose. Eclampsia IV loading dose 4 to 6 gram over 15 to 20 min. Maintenance 1 to 2 gram. Hypomagnesemia IV 1 to 2 grams over 1 hour. Repeat as needed. Tocolysis IV loading 4 to 6 grams, then 1-2 gram infusion. Constipation oral 10 to 30 grams in water once daily or as needed. Torsades de Pointes 1 to 2 gram IV over 15 minutes. Missed dose and overdose. Missed dose IV administer as soon as remembered in a controlled setting. Overdose symptoms: respiratory depression, hypotension, loss of deep tendon reflexes, cardiac arrest, coma. Treatment: IV calcium gluconate antidote, mechanical ventilation, dialysis if needed. Stop or avoid taking. If signs of magnesium toxicity occur: flushing, nausea, muscle weakness, difficulty breathing. Urine output drops below 100 milliliters in 4 hours. Respiratory rate is under 12 min. Loss of deep tendon reflexes. 11. Side effects. In detail: common, flushing, nausea, vomiting, drowsiness. Serious, hypotension, bradycardia, respiratory depression, loss of reflexes, cardiac arrest, muscle paralysis, confusion, coma, in overdose. 12. Vital information. Monitor vitals regularly. BP, heart rate, respiratory rate. Assess deep tendon reflexes, especially in obstetric use. Monitor renal function and serum magnesium levels. Keep calcium gluconate available as an antidote for overdose. Only use under medical supervision for IVIM forms. At 13. Other drugs that will affect magnesium sulfate. CNS depressants, e.g. benzodiazepines, opioids. Additive CNS depression, calcium channel blockers. Increased risk of hypotension and neuromuscular blockade. Neuromuscular blockers, e.g. succinylcholine. Enhanced effect and risk of prolonged paralysis. Loop diuretics can increase magnesium loss, oral forms. Digitalis, caution due to electrolyte imbalances. Thank you. Have a nice day.